Diabetes, but prevention clearly is, I think, one of the most important aspects of dealing with the disease that's impacting Indian country. And the communities, the tribal communities, have demonstrated the success of how they can work together within the community and expand not only just the initial program, but to reach into other aspects of the community so it becomes a comprehensive approach to it. But prevention clearly is important. We've seen some success in prevention of amputations in some programs that I would like to see expanded, wound care programs, etc., that I think have real benefit to those that already have diabetes, and I think that those are some of those initiatives that we really need to target. And as far as healthcare reform, one of the things that I continue to hear is access to care, and I think that that's one of the biggest challenges across the system. Is access, the ability of eligible patients to access competent care, both within our system and within the private sector. And what we can do to improve that, I think, is going to be critical to health reform.
Thank you. If you were going to point to one or two programs in diabetes prevention or treatment, who would you point us to, sort of the most successful nation's programs? Who would you point to? Who are the stars here?
There are so many stars. I think the hearing would go on all afternoon if I told you about the people that I consider the stars in the system. I worked with one part of the special diabetes program for Indians called the demonstration projects. They were given a special amount of money to implement either diabetes prevention or cardiovascular disease prevention. And there were 66 programs that were in that initiative alone. It was $27.4 million per year. I could brag about them all day because what they did is they took the challenge from Congress. Congress said, we want you to demonstrate that you can take the results from research, proven interventions, and to implement those in diverse American Indian and Alaska Native communities and show that you can achieve similar outcomes. Those 66 programs have done just that. Facing enormous challenges of small programs, large programs, rural, urban, IHS programs, difficulty recruiting healthcare providers, but what we've seen in the diabetes prevention program part is that they've been able to implement a 16-week curriculum, teach people how to eat healthy, teach people to exercise more, and people are losing weight. We achieved the same weight loss results in the early part of the program as the original research study, the diabetes prevention program. So, and they also have demonstrated reductions in other risk factors as well. In the cardiovascular, the Healthy Heart program, we're definitely seeing reductions in the risk factors for heart disease. Less people smoking. We're seeing blood pressures go down. We're seeing cholesterol go down. So for me to single out one program would be very difficult. I think that we've been able to show as an organization, if we're given congressional money, we have the capability of implementing a rigorous intervention, and we can evaluate it well, and we can do it in diverse communities. So I'd be happy to come talk with you about.
Thank you. Well, if you ever have a chance, I'd like to do that, and I hope we can pass a bill this year to implement all these great ideas. Thank you very much.